And then we were ready, and then we could turn it off in 2 minutes. All right, Cora. Cora, go ahead and just say something.
Hello? It sounds like an, oh, it's my,
All right.
it works.
All right, Cora. Hot mic.
Always a hot mic. I wanna, I don't have to do anything with that, right? I just will have to stop sharing it once the presentation is over. Okay. Oh. All right, it is 6 o'clock. So good evening, everyone that's in person and joining us virtually. My name is Cora Faith Walker, and I am the Chief Policy Officer for St. Louis County Executive Dr. Sam Page. Joining me this evening is the St. Louis County CARES team. That includes Deanna Banker, the Chief Administrative Officer, Dr. Faisal Khan, the Acting Director of Public Health, Emily Koenig, the Acting Director of Children's Services Fund, Yusuf Scroggins, the Director of Community Engagement at Human Services, Rodney Krim, the Executive Director of the St. Louis Economic Development Partnership, Jansen Thomas, the Prevailing Wage Coordinator for the county, Michelle Ryan, Director of the Office of Emergency Management, Jen Keating, the Deputy Director of Administration, Vicki Frederick, the Chief Accounting Officer, Chuck Henderson, the Director of IT, and then Paul Kreitler, our Budget Director. And we are pleased to present this evening at this community town hall, the St. Louis County CARES Year in Review Report. 15 months have passed since the Coronavirus Aid, Relief, and Economic Securities Act was enacted, and the county executive and the St. Louis County CARES team are committed to promoting transparency around this unprecedented amount of pandemic response funding that includes both the CARES Act and then the upcoming funds in ARPA, as well as other pandemic relief legislation and funding. We certainly recognize that transparency, accountability, and oversight is essential to ensuring that programs and services that St. Louis County has mounted in response to this unprecedented emergency actually does go to the areas in which they're intended to go and helps the folks in the community that they're intended to serve. And just to put this in perspective, the more than $5 trillion in relief aid that's been provided to address this pandemic over the past year or so is more than the federal government's total spending in 2019 for all discretionary, mandatory, and interest on the debt. So we are talking about unprecedented levels of funding. And St. Louis County in March of 2020, like many local jurisdictions across the United States, really confronted a stark new reality as the COVID-19 pandemic brought hardships to the communities that we serve that we've not seen in over a century. An essential resource, though, for funding in our urgent response efforts was the $173 million in CRF funding that St. Louis County received from the U.S. Treasury. And thanks to the swift and decisive action of the council last year in appropriating the CRF dollars to the county executive's administration, the county executive's administration and county departments, many of whom are represented here today, were able to immediately begin pivoting our resources, time, energy, programs, and services to address the impacts of this public health crisis in real time. We have used CARES Act funding over the past 15 months to support the health and well-being of our residents and communities through a wide range of programs that we're going to discuss further this evening, including diagnostic testing and contact tracing, food distribution, rent relief, support for businesses, investments in technology, and working to bridge the digital divide. Today, as many jurisdictions, local leaders, and the St. Louis County Council is preparing to make decisions about this next round of funding that's coming through ARPA. We hope that the information that we provide today can be instructive and informative as we move forward to continue to meet the responsibilities to the people that we serve in this community. I just want to also take a moment to thank everyone that's here today, that's here representing the county. The speed at which the money was dispersed over the past 15 months, and just the sheer amount of funding that St. Louis County received really meant an undertaking that required a whole of government effort, and was really just a monumental magnitude of work that was done. And so we really are grateful for all of the dedication of the employees and folks that work for St. Louis County that really worked very, very hard to make sure that the community was served, as well as the volunteers from the community and many of the nonprofits, businesses, agencies, and really everyone in St. Louis County that met the moment to respond to this crisis. So with that in mind, as this report looks back at the road we've traveled so far, some of the allocations, outcomes, the lessons learned, and highlights of key areas of programs and services that St. Louis County was able to offer to its residents during the pandemic, I just want everyone to really keep in mind that thanks to the swift action of the council, the leadership of the county executive and his administration, and the dedication of the folks that are here this evening and their teams, St. Louis County Cares was able to help save the lives and livelihoods of folks throughout the region. So with that, I'm going to just give a brief overview of the discussion today. We're going to have a bit of background and context provided by Dr. Faisal Khan, and we will then move into some discussion of the structure of the St. Louis County Cares programs, the administration budget compliance. We'll then hear from different team leads about some of the specific programs and services that were offered from the St. Louis County Cares programs, the humanitarian, the health, economic recovery, municipal relief, and then finally St. Louis County Core. And then we'll talk about some of the key takeaways and lessons learned, as well as some thoughts about looking ahead. And so with that, I am going to be delighted to turn it over to Dr. Faisal Khan. I did want to make one housekeeping note for folks that are here in attendance and or are online. We have note cards in the back for people to write down any sort of questions that they might have throughout the presentation. We just wave and someone that's here will be happy to come in and bring one to you. Or if you would like to submit them online, you could submit them to dvanker@stlouiscountymo.gov. So with that, Dr. Khan, I'll turn it over to you.
Thank you, Cora. Good evening, ladies and gentlemen. Context is very important. As we seek to understand CARES Act funding and how it was spent, it is important to take a look back at the situation that we were confronted with in 2020. This is illustrative of the picture in March through November of 2020. In the words of Mike Tyson, everyone has a plan until you get punched in the face. The magnitude and severity of this public health crisis, this economic crisis, really is unprecedented in terms of emergency response. It knocked the wind out of the best laid plans at the federal, state, and local levels. Case in point, 100 years ago, the Spanish flu pandemic really devastated the world. Millions died, including in the United States. Today, there are at least 10 journal articles and 1 book published every year about that pandemic, taking a look at different aspects of it. So back to this slide, the period that we're looking at here, which came around mid-year, was the worst part of the pandemic. And that lasted, once again, through pretty much the end of December, with another peak coming in the fall and winter. These numbers are very familiar because the St. Louis Metropolitan Task Force has been putting these out at their weekly press conferences, and they became synonymous with bulletins and updates across this region. Just to give you an idea, 99 hospitalized, 27 ICU admissions, and various degrees of morbidity related to the illness across the region. And by the way, it is important to point out, I think, once again, as context, this past Friday, there were 86 individuals hospitalized on ICU beds across the St. Louis metropolitan region. All of them were unvaccinated individuals. All of them were between the ages of 18 to 45. The task force began to track hospital admissions as well as tests performed at various hospitals as a sentinel measure of the progression of the pandemic across the region. This included task force hospital COVID deaths reported. You will remember that the period between March through May last year was particularly devastating for long-term care facilities and nursing homes, where the most vulnerable population across the region resides. This virus spread through those facilities like wildfire. They didn't know how to deal with it. They didn't have the equipment or the skill necessary to contain it. On March 7th, we became yet another statistic in terms of the death toll that began to mount across the St. Louis region. When Congress approved the CARES Act on March 27th, the money began to flow for emergency relief across the United States. And on April 28th, the St. Louis County Council acted proactively to provide that support across the region. We're very grateful for it. But I would take you back once again to the beginning of this pandemic. No, as a system, we were not prepared for it. The United States was not prepared for it. We struggled to find test kits. We struggled to find personal protective equipment. We struggled to figure out how the virus was spreading in communities and community subgroups. To date, the history of the scientific community and its association with this virus in terms of studying it is only 14 months old. That is not even a blink of an eyelid in terms of studying a particular pathogen. What we know about this virus could fit on the tip of a pin today. That is the plain truth. What will play out in the months, weeks ahead, only Providence alone knows. The virus will decide when it is done with us. Cora, I will hand things back to you.
Thank you, Dr. Khan. Thank you so much for just setting the stage and providing the context for us so that we can remember why we're here. I'm going to jump ahead a little bit to talk about the administration, budget, and compliance components of St. Louis County CARES and the structure around how the $173.5 million in CRF funds that we received was spent. And so just as a reminder, again, St. Louis County Executive Dr. Page early on established as the overarching mission of the St. Louis County CARES recovery and response programs to make an immediate and strategic impact in the county through direct public health, humanitarian, and economic investments for the most vulnerable and affected populations. And equity was very much so at the center of the values of the St. Louis County CARES approach, and was bolstered by both transparency in the online portal that tracked all of the expenditures that were made through CARES funding, as well as accountability that was seen through the 17 different oversight committee hearings that we held with the county council over the past year, and the numerous reports that were required to be made to the Department of Treasury's Office of Inspector General, that is the oversight body at the federal level. In terms of structure, again, I just mentioned the St. Louis County Council Special Committee on oversight of, or for oversight of COVID-19 funding and expenditures. And that really was sort of the umbrella that oversaw the leadership that was provided by the Office of the County Executive and supported by some really dedicated community volunteers. And additionally, as folks I'm sure remember, the county executive identified 3 main priorities. First, in terms of the response with CARES, that's health. That was led by the Department of Public Health as well as the Office of Emergency Management in conjunction with each other. The humanitarian efforts, which were led by the Department of Human Services and Children's Services Fund, and then the economic recovery, which was supported and by the Office of the County Executive and led by the Economic Development Partnership. Additionally, we recognize that government also needed to use some of these funds in order to protect constituents and employees. And so through the municipal reserve and the municipal relief program, which we'll talk about in a little bit, and the county core program, which was the county employee and constituent safety program that was led by the Office of the County Executive and the Office of Emergency Management. All of this was supported by some incredibly dedicated work, professional services that were provided by the Office of the County Counselor for Legal Services, the Department of Administration, the Department of Information Technology as well, in terms of making sure that we have the sort of systems and structures in place to administer these funds. These are the names of the individuals. This is all information that's available online and to everyone. And with that, I want to turn it over to Paul Kreitler, who is the budget director, to talk a little bit about where we are currently with the budget and the rest of the county CARES funds.
Thank you, Cora. My name is Paul Kreidler. I'm the county's budget director. And I'll just take a quick moment to talk about the current budget status of the Coronavirus Relief Fund. And I also would mention that this data is available on our transparency portal, stlcorona.com, and it's updated every morning. So here on the first column here, we have the individual program areas from public health through county response. The next column is the budget that we received for the Coronavirus Relief Fund of $173.5 million. Next column are the actual expenditures. So this represents money that's gone out the door. As of yesterday, $135.7 million. We have another $15.8 million in the next column that is under a requisition or encumbrance. So that's either a transaction that we have started or there's a formal commitment to spend those funds. And that means that we have $22.0 million remaining to use from the allocation through the end of the program. Just 2 caveats I'll mention is that if you go to stlcorona.com, you'll see a number that's higher in actual expenditures, and that's because we have 60 million plus of eligible payroll costs that are, again, eligible for the program, but we have not yet decided if or how much of those we will record against the program. One other thing to mention, if you track this closely, you may from time to time see actual expenditures decrease. And that happens because we review our expenditures and we determine if there are other federal sources that would be more advantageous for us to take advantage of. And typically you'll see things that will move from this funding source to FEMA. So this is very much there are moving parts here. And just know that the administration and compliance team is focused on leveraging as many federal dollars as we can to supplement the county's response. Corey, did you want me to go through these slides as well? Sure, so here we're going through and just breaking down the individual program areas into a little more detail. I won't read them all, they're here available for you. But again, health, 49 million. Of that, 23 million has been spent. Humanitarian, 30.6 million. $20.5 million for economic recovery. And we have $47 million for municipal reserve and $20.5 for county response. And we'll talk about those individual efforts in more detail as we go on.
Hello, my name is Christina Capello and I'm a senior manager at Deloitte. We have been working with the county for 9 months on overall strategy, closeout, and compliance of the CARES Act funding that we're talking about today. I have 10 years of experience working in federal grant funding, starting with Hurricane Katrina in Louisiana and working in other states such as Colorado, Puerto Rico, Texas, New York, and Missouri. And if you had told me when I was 7 that I was going to be the compliance person, first of all, I wouldn't have known what that meant. And second of all, I probably wouldn't have believed you. But here I am with 10 years of experience, and my specialty is closeout and grant compliance of federal grant funding. The first thing that you need to know about federal grant funding is that it comes with a lot of rules and regulations that are tied to it. CARES Act tried to not put quite as many rules in place, but it actually made things more complicated because that meant that governments all across the country were trying to balance what was listed in the rules versus what we thought the auditors might want 3 years from now. The American Rescue Plan Act, or ARPA, as we've been calling it fondly, those rules are actually still being written. And so governments all over the country are building the plane while they are flying it and are building programs according to what we believe the compliance rules might be based on other federal grant programs in place. No matter what, we know that compliance for a grant program is very important. It helps to make sure that federal tax dollars are spent effectively and compliantly, and the way that the government who is spending them wants them to be spent in alignment with their mission. And so what we're sharing with you here today on the screen is 4 reasons that you would want to set up a compliance program. It helps to mitigate fraud, waste, and abuse. So by putting controls in place from the very beginning, you have a higher risk of catching folks who maybe didn't have the best of intentions, and this will help to mitigate reputational risk as well as the misuse of funding. Second, this can help you identify high-risk applicants. It's good for anybody who's spending money to know where the highest risk might be so that you monitor that a little bit more closely to make sure that you are reviewing people's policies and procedures to make sure that they have the controls in place to spend grant funding compliantly, so that the people who have to monitor that have confidence in the fact that the money was spent compliantly. Next up, preparing for an OIG audit is definitely one reason that you would want a compliance program. OIG, Office of the Inspector General. This means that, so 3 years after grant closeout, somebody can come back and ask you for the documentation to support the expense that you expended. And so what you want to do during that time that you are spending the money is to build these very complete packets of documentation that include invoices and policies in place at the time of the disaster and proof of payment and certifications. And your goal is to have all of this together while things are happening and to set up programs to let people know that that is the exact documentation that you need so that when somebody does come back in 3 years, you can be very confident in the packet of information that you have. And what happens if something doesn't go great during this audit? Well, that leads us to the 4th item on the list. There could be a deobligation risk. So deobligation, sometimes called clawback, if money is spent incorrectly, if it is ineligible, if it is a duplicated benefit, somebody might come back and try to take that money back. But it's not necessarily at the time that you're spending it. So 3 years from now, somebody comes back and says that $100,000 wasn't eligible. The government in place at that time needs to find $100,000 in their current budget to give back in order to make up the difference. And what we're here to do and set up these programs with, and what the county has done a great job of, is setting up compliance programs to try to make it so that folks who get money have the highest opportunity to keep that money. And so overall, compliance is as you can tell, very important, from program setup and writing grant applications to how you keep that packet of documentation all the way through closeout. And we've been very excited to be helping the county, and we're excited to continue to help do so.
Great. Thank you so much, Christina. Deloitte's been a very important partner in all of this, and we really do appreciate all of your help and efforts. So a couple of other quick things that I just want to mention before we move into talking more about the specifics of the various programs in St. Louis County Cares was the really dynamic and unpredictable regulatory environment within which we had to operate over the past year. Between the first case of COVID being diagnosed in St. Louis County, the initiation of the county emergency response in March, and the receipt of the $173.5 million in CRF funding that came in April that next month. There were close to 16 various material changes in either the regulations or the guidance or the frequently asked questions that the Department of the Treasury published that regulated how these funds could be used. And so this is really just a timeline that shows that really up until a couple of months ago of this year, there was a lot of uncertainty around what the requirements were for both spending the funds, for reporting and documentation requirements, and just the overall administration. And so, again, I really do just want to commend the hard work and efforts of really the whole of government and everyone in the county that worked on county cares, who in the face of this uncertainty recognized the needs that existed in the community and the emergency that we were facing, and made sure that we expended these millions and millions of dollars getting them out to folks that really needed them. And so this is something that just really, again, just kind of shows what the sort of dynamic environment is that we were dealing with over the past year, and that we currently are still dealing with. I'm sure we'll talk about this towards the end, but new regulations, changes in regulations with ARPA are coming out as we speak. There were some updates that came out today to the FAQ. So again, this is just a reminder that we are dealing with a pretty dynamic environment, and in the face of all that, making sure that we get the funds out the door and into the community. So with that, I am going to get ready to turn it back over to Dr. Khan, who will talk about the health response that was part and the primary focus of the St. Louis County Cares program.
Thank you, Cora. There was one single objective: saving lives. By decreasing the rate and extent of COVID-19 spread through increasing community awareness, enforcing social distancing, and providing equitable access to testing and prevention. A lofty goal, but one that was met with several challenges at the very front of it. As you can imagine, procuring personal protective equipment or test kits at the onset of the pandemic was a Herculean task. You will all remember the stories of states, the federal government, and municipal entities bidding against each other at the same suppliers to procure testing kits and PPE. In terms of what we spent the money on, testing was obviously the greatest area of need. We also conducted a prevalence study in partnership with Washington University to try and characterize the pandemic in the St. Louis region, to try to understand what the community dynamics of its spread were, where it was likely to have the greatest impact. We also provided community health provider grants to federally qualified health centers in the St. Louis region to try and develop a collaborative partnership with the healthcare safety net that extends across the St. Louis region, caring for the most vulnerable people, the underserved communities around us. We also secured mental health provider grant programs to try and shore up acute mental health care services in the midst of the pandemic. As you can imagine, when hospitals shut down, community health centers imposed restrictions, and private care practices virtually came to a halt, the mental health crisis in the United States, which was a crisis pre-pandemic, was exacerbated 10 times over, and I am probably off the mark by several fold. That crisis has only gone from bad to worse, by the way. This amount of money was minuscule in terms of an investment in mental health services, but it was desperately needed at the time. PPE was a huge expense. Multiple suppliers, questionable quality. How do we figure out in a hyper-competitive, confusing environment what supply chains can be relied upon to provide the best quality PPE for our first responders, for our clinical care providers, our public health professionals, and all partner agencies. Community engagement and contact tracing and investigation. Building trust through community engagement, providing social support, including referrals to other non-clinical services, was a critical aspect. Contact tracing and investigation continues to this day. At some point in time in the hopefully not too distant future, COVID will fade into the background and become an endemic disorder. It will never quite leave us. And at that point in time, we will be dealing with sporadic outbreaks, particularly in unvaccinated communities. Contact tracing, case investigations are the basic gumshoe detective tools in the hands of public health to conduct those investigations. Think about West Nile virus. When it first arrived, it created a huge crisis. There was panic. You don't hear much about West Nile virus today because it does occur. We do get a handful of cases. We even have a couple of deaths every year in the state of Missouri. We've had deaths in the St. Louis region in the last 5 years, but it has faded into the background and become an endemic disease. When it happens, we investigate it, we identify cases, find out where they were, put in place the mitigating steps necessary to prevent spread. Other public health expenses, which were unanticipated, obviously, we were fighting a battle in which we knew very little about the adversary and its ability to change and adapt and introduce multiple new strains. And administration, which is a catch-all for all the tasks that were necessary to mount an effective response. The number one resource that we lacked across the country, including St. Louis County, was people with the right skill sets, the right experience, the right attitude to go into battle on this. All workforces are finite and limited. Public health has suffered a chronic crisis of underfunding over many decades. The net result was we had a system which was underprepared and underfunded to mount a response of this magnitude. In terms of broad categories, obviously, we've talked about COVID testing, prevalence investigations, community and school PPE, in terms of supplying that to our partners, healthcare response grants to community health centers to shore up basic primary care and testing capacity and use that as a workforce multiplier, and other public health expenses. All right. Oh, sorry. There we go. I'd like to show you a video that will help explain a lot of this. It won't work. Okay. No worries, I can go back to the presentation. Okay, bear with me for 1 second, please. What slide number were we at? 35. There we go. I'll just skip ahead. All right, moving on from that. Move this video box out of the way. Okay, I'm not going to bore you with the specifics here. For the federally qualified health centers, People's Health Center received $578,000, CARE STL about $1.5 million, Affinia just under $1 million, and the Regional Healthcare Commission also received a significant amount. Contracted lab partners, obviously, in terms of diagnostics and testing, we needed to have that spread out across the region. So awards were made to SSM, Quest, Microgen Diagnostics, and WashU to shore up our lab capacity. For our own lab infrastructure, we contracted with Abbott EMS as well as Molecular Analyzer to shore up the diagnostic capabilities that we have. 36,000 plus tests were done and counting. For the prevalence study, the total amount was just under $1 million. It was a partnership with WashU to try and characterize the dynamics and the various ways in which the pandemic was affecting St. Louis residents. 1,300 residents received a test over a 60-day period as part of the prevalence study, in addition to structured questionnaires to try and figure out what was going on. Healthcare response grants, participatory budgeting is something I would like to highlight. That is a hallmark of the public health approach towards addressing public health problems, which basically means we involve the people and the communities directly impacted by the public health issue in figuring out how they want the money spent to best serve their communities. This is literally a case of inviting popular opinion leaders, grandmothers, grandfathers, the single moms, dads, teens around the table and putting a problem in front of them with some solution options and mediating a conversation to figure out how we can help them arrive at consensus for how the money should be spent. I know that is very difficult to read, but there we go. That provides you a broad overview of the mental and behavioral health spending category, which I mentioned earlier. There was a whole list of agencies that we worked with to try and shore up the acute mental health care crisis that the pandemic spawned. And finally, but not to denigrate that, PPE distribution by the numbers, 4.2 million masks, 100,000 across the county school districts, 275,000 masks across 24 municipalities, and 50,000 for the Board of Elections, because we did have a major public event in the form of the 2020 election cycle to deal with. Our gratitude to the Board of Elections for working with us on that. School districts, one of the key components of any crisis response, but particularly one related to an illness such as COVID. As you can see, almost every school district was covered. The awards ranged from 128,000 to the highest being for Hazelwood at 365,000. And those partnerships are something we are keenly developing to adapt to future public health needs. Other public health needs, call centers, contact tracing, working with universities, etc. Cora, back to you.
Thank you so much, Dr. Khan. Again, this is a public health emergency first and foremost, and so we certainly are grateful for all of the hard work and dedication of the folks in the Department of Public Health, as well as the folks at the Office of Emergency Management, and really have been so impressed by the collaboration between these two departments. Next, I am going to turn it over to Emily Koenig, who's the Acting Director of Children's Services Fund, to talk about the humanitarian response.
Great. Thank you, Cora. Thank you, everyone. Great opportunity to be here tonight and talk about this very important work. I'm Emily Koenig, Acting Director of the St. Louis County Children's Service Fund. So we've heard a lot about the health effects in our community related to the COVID-19 crisis. And beyond that, the speed and the scale of the pandemic had an impact on the delivery and the need for additional services and supports for our most vulnerable. By protecting the health and safety of the county citizens, there were many ramifications related to unemployment, food insecurity, housing, education, and mental health. In response, the second strategy of the county's COVID-19 pandemic response focused on helping residents meet, I think I have to flip this, helping residents meet the basic needs like food, housing, safety, health, and addressing vulnerable populations like children, seniors, individuals with disabilities, and the unhoused. The humanitarian work group, comprised of myself and co-led by Andrea Jackson Jennings, the Director of the Department of Human Services, and our volunteer, wonderful Deborah Patterson, met weekly to discuss growing and emerging needs in our community. We collaborated with other private and public funders, community coalitions like the Regional Response Team, service providers, and community members to help in program design and implementation. The environment was constantly changing over the course of 2020, and we worked hard to remain flexible and responsive to the ever-changing needs of the community. In addition, we were continually assessing what other funding opportunities were available so to avoid duplication of assistance. So this is a budget breakdown, which Paul alluded to in his presentation. And you can see that there are 5 or 6 main categories under the humanitarian bucket, including food security, humanitarian relief fund, domestic violence response, our child care relief response, our digital and equity initiative. So I'll talk about each of these a little bit more in depth. Food security. So this was an immediate county response. It was the first response that the county implemented, and this was to address the growing food insecurity in our community due to school closures and rising unemployment. We have many families that already are food insecure, and just one loss of a job put many other families on the cusp of food insecurity. Initially, the county allocated, I don't think we're watching videos, right? Oops. Oh, I didn't mean to go out of there. Okay, there we go. So initially, the county allocated approximately $4 million to 5 partners. But as the pandemic continued through the summer and the fall and schools remained closed, there was an ever-growing need and a need to continue to support the food distribution throughout the community. So in total, the county has allocated over the last 8 to 9 months, $10.6 million to 7 providers, and provided nearly 10 million meals served in the community through churches, our schools, community providers, and the libraries. So the next main bucket of funding was under the what we call our broader humanitarian response program. In June, we released a competitive RFP under this program. A total of $9.5 million was made available to nonprofit organizations to adapt operations to meet new and growing needs, deliver services in ways to accommodate public health measures, and serve additional clients. The RFP contained 4 impact areas, including housing stabilization and homeless prevention. So $7 million was allocated in this area for utility assistance, rental assistance, mortgage assistance, case management, screening and referral, and legal advocacy related to anti-eviction. The second program was related to seniors and homebound who were impacted significantly and suffered from social isolation through the pandemic. And so funding through this programming was meant to address social isolation, to provide meals, care coordination and case management, cleaning supplies and other PPE, and in some cases, technology and health support. The third category was technology. We all know we moved into a digital space whether we wanted to or not, and recognized that technology was desperately needed in many of our service provider organizations, our schools, our families, and our homes. So this funding provided technology to organizations to address the social and emotional isolation, providing access to health, social services, education, and other support networks. And then finally, the social and emotional wellness of young children. The impact of stay-at-home orders and oftentimes COVID in their families has created a growing mental health crisis. As Dr. Khan mentioned that, we were definitely on the cusp. And so this provided technical assistance to childcare providers and in-home providers to help support the mental health of young children, to help them get through the pandemic. So that was a total of $9.5 million. This is just a little information about our process. We had RFPs. We also used external reviewers. So we recruited 37 external reviewers in addition to Department of Human Services and Children's Service Fund staff to evaluate those proposals. Ultimately, we've funded 60 organizations and 97 programs. We received a total of $17 million in requests. So this is, again, this is small, so you can't see this, but this is a snapshot of the, just keep clicking. Okay, great. This is a snapshot of those organizations by impact area, as well as the amount funded. And again, this is online. You can dig into detail related to those. Seniors and homebound, 4 social and emotional, and then several technology. Our child care relief program. So as the stay-at-home orders were lifted and the early spring and late spring and early summer, and the economy started to open back up, it was really critical for us to address the child care community and the need for quality safe care for parents to go back to work and know that their kid, their child is in a safe facility that has the proper protocols in place to address COVID-19. So the child care relief program allocated, there's Steve, Steve's in the back. So I think we're gonna skip through but hopefully you'll all get a chance to review this online. He's a great spokesperson for holding the mental health in our hearts and in our hands. So great spokesperson for this. So again, this was the child care relief program was designed to provide support to continue to operate safely and effectively, to comply with county and CDC guidelines, and to help support the cost of business interruption. Many child cares closed for a 3-month or even longer time period during the stay at home. And so it addressed some of those concerns that we have safe and quality child care to return to when we go back to work. The estimated allocation for this was really based upon all 400 licensed childcare providers applying for this funding. So we, again, had an open RFP process. We contracted with United for Children and Child Care Aware, who are statewide organizations. They provided technical assistance in grant writing. They provided technology. So some child cares didn't have access to the technology to print and scan and fill out the application and computers. So they provided technical assistance to these child cares across the state, or across the region rather. The county received 108 applications totaling $1.8 million, and we ultimately funded 93 organizations representing 122 sites across St. Louis County. So this is a distribution of where funding was across the region. So you can see a higher concentration in, and this is by council district 1 and 4, and then just a breakdown of the total funding by council district as well. So the Domestic Violence Response Fund was our fourth category. Again, a competitive RFP. This time, St. Louis County Children's Service Fund and Department of Human Services reviewed these grants internally. Although the stay-at-home orders were designed to protect the public from the pandemic, it left many at home confined with their abusers. We've seen the rates of domestic violence and child abuse and neglect increase over the last 18 months. And then oftentimes women or men were too afraid to go to shelter for fear of contracting COVID-19. So this program is really designed to allocate $1 million and a 4-pronged strategy to address the needs of those impacted by intimate partner violence. Awards in the Domestic Violence Fund were with 4 key categories: increasing health protections in shelter, so ensuring they have the safety protocols in place, they have PPE, they have cleaning supplies, ensuring continuity of service through technology, so providing teletherapy, internet-based groups, remote services, preventing domestic and sexual violence, so increasing prevention programming, raising public awareness of available resources, so through hotlines and other resources. Again, we received 13 proposals totaling $1.8 million, and we funded 11 of those organizations. And this is a snapshot of those. And finally, one of my favorite initiatives is our Digital Equity Initiative. We, as the pandemic, again, continued into the fall, and as superintendents and school boards were in the impossible situation of deciding to return to in-person with safety measures in place or starting the year virtual. Well, as we know, most schools began the 2020 school year virtually, and we partnered with the St. Louis County, thank you. We partnered with the St. Louis County Library, awarding them $4 million in July of 2020 to bridge the digital divide for students and families. In March 2020, the St. Louis County Library conducted a survey and found that more than 10,000 households lacked access to internet. So obviously, that impacts health, well-being, education when we're in a virtual world. So St. Louis County sought to provide hotspots and Chromebooks to students through this initiative to ensure access to resources in order for those students to be successful. We were able to meet the entire mobile hotspot need. So we had 10,000 families without internet access. We were able to provide 9,828 mobile hotspots, and those could host up to 5 devices, and 6,085 Chromebooks which met about half the need in the county. Professional tutoring services were also available 24/7 online. In-person tutoring also became available through Miriam Learning Center, who are experts in providing education to unique learners. So as you can imagine, there are some students who might not respond very well to online tutoring and classes. And in February of 2021, we awarded the St. Louis County Library an additional $1.6 million to help bridge the divide for seniors who were suffering from social isolation. Although the initial humanitarian response fund, I haven't shifted through here. One more, I think. Okay. So this is a snapshot of the distribution of hotspots and Chromebooks across the county. You can see Chromebooks were generally allocated in the North region. Need was defined by the school. So they identified students and families that needed access to the internet and Chromebooks. This was available to both parochial and private schools. You can see a breakdown there as well. Whoops. Am I out? Oh, okay. So finally, I was talking about the seniors and technology. You know, as time grew, we talked about how we were continually assessing what the need was in the community. And even though we provided some technology through the Humanitarian Response Fund, there was a lot of advocacy by senior based organizations to address additional technology needs. So we provided $1.6 million to the St. Louis County Library again, and they purchased 1,485 one-year subscriptions to GrandPad tablets. So these are tablets that are specifically designed by and for seniors with limited experience with technology. And we've received so much positive feedback from those individuals who received the GrandPads and how they're able to connect with their doctors, they're able to connect with their families, with the county, interact with the county as well. So with that, I am going to ask Dr. Yusuf Skagen to come up with the Department of Human Services, and he's going to give us a little bit more context into our work around homeless prevention and housing stabilization, where we are now in the context of 2021. Thank you.
Thank you, Emily, and certainly thank you all for this opportunity to share about the impact and the work that we've done over this period of time. Emily did a great job of sharing an overview of the housing services that were engaged, which were around housing stability and homeless prevention. But I think what the audience also would be remiss in not addressing is the pandemic also is still with us. And so hardship that was experienced last year is still impacting us to this day. We have a eviction moratorium through the CDC and then also in the county that is due to expire next Wednesday. And so while the $7 million that was deployed last year has certainly been helpful, serviced over 4,000 households last year on an average of about $2,000 was provided. Since individuals have still been unemployed, had loss of income, increase of expenses during that time, it has certainly still remained with us to this day. So on April the 5th, we launched our Emergency Rental Assistance Program. That is a program that was facilitated through the $29.735 million that is afforded to St. Louis County residents to apply for rental assistance and utility assistance. That is really in the throes of mitigating the impact of displacement during this time. And so to date, we have over 4,700 applications. And I would encourage anyone in the community who is needing the assistance to visit our website. There is a dashboard that allows you to keep an update as to the available resources. And this is what is going to ultimately make our community whole. We know that a number of households had just small changes. Many have mentioned how hardship either directly because of the COVID virus or indirectly may have caused households to have a loss of income. It could have been just a simple dollar or a dollar increase in expenses. And the degree to which that can impact households who are already on the margins is critical for us to address. So again, I encourage anyone to visit our website. The Emergency Rental Assistance Program is available, and the application can be filled out there. This is critical across the board. Again, next Wednesday is the expiration of our moratorium on evictions. The degree to which our community is not able to see huge number of households displaced is based upon our ability to ensure that those households receive the resources. It is not only the household's responsibility, but also landlords who are willing to participate in this program that is critical. So with that, I just wanted to thank you for this opportunity.
Thank you, Dr. Scoggins and Emily. And for those that are listening, that website is stlcorona.com. You can go there to get more information about the Emergency Rental Assistance Program. I am going to now turn it over to Rodney Krim with the St. Louis Economic Development Partnership to talk about the economic recovery response. Rodney?
All right, thank you, Cora. And you see in your slides, we'll go through some more specific details, but I can just really remember that period of time in March of 2020, and all the stay-at-home orders, we knew we had to help people stay safe, that it was such a significant feeling that, okay, what are we going to do? And so panic set in with the businesses because they knew that they had to keep their people safe. They had to close. They had to comply with the stay-at-home orders. And just wondering, what were they going to do? And I remember talking to some of my fellow economic development colleagues on how can we help. And it was just so fortunate that County Executive Dr. Sam Page said, okay, let's create an economic rescue team. And it was fortunate that also the County Council said, let's support this economic rescue team. And so we were fortunate to establish a steering committee led by Rick Stevens. And Rick is the president of Christian Hospital in North St. Louis County. And, you know, someone who has his kind of ear to the ground on what's happening in the community. There were steering committee members that were added to the group that represented a variety of functions, including labor, also the minority and immigrant community, small business and industry, and workforce. And it was critical to have those components on this steering committee. And then the steering committee established working groups, 4 working groups that kind of followed along those same lines. And so we had a great video. You would have seen this star right here talking about all the wonderful things that occurred. But we're going to go past that if I can. Or is it starting? Is there a way to get past it? Okay, there we go. And so this gives kind of an illustration of the steering committee and the 4 working groups. And so the key to these working groups were to kind of focus on critical areas that could help move our community forward. Identifying what the issues were under each of those titles, small business and industry, the community development, workforce, and minority and immigrant-owned businesses. And we would get calls because businesses wanted to know somebody cared. Somebody was looking out for them. And so this approach really did help us establish a relationship and support for these businesses. So what did the economic rescue team do? Okay, first focused on all the medical. We said, okay, all the medical orders are critical to keep people safe. And so you see a number of those listed. And then the committee and the economic rescue team went into action mode. Again, meeting on a very frequent basis to come up with solutions that could really help these businesses and our community overall. That has led to a economic rescue team report that's over 70 pages. It covers a number of different specific issues and opportunities. It led to helping to identify areas to spend CARES money, and we'll talk about that in a second. But it also provides a great foundation for ongoing use of funding to not only deal with immediate issues, but also to address issues over time to make things more sustainable for our businesses and our community. And so this kind of gives you a feel for some of those strategies that kind of came out of the economic rescue team. There were 19 strategies that, again, we hope provide a foundation for additional monies that we hope to be able to obtain to try to achieve some of these ideas which are sustainable over the long term. But just going back, so we started with the Small Business Relief Fund. And with this, about $19 million was provided to about 1,700 businesses that had desperate need. How do we handle payroll? How do we handle expenses related to trying to keep people safe? The occupancy levels were significantly lower than what they would normally be. And so how do we do all of that? And so these dollars really came in handy to help these businesses. As you see, up to about $15,000 per business. But this required, as what was said earlier, we had to make sure we were in compliance with all of these rules. And as Deloitte mentioned, we had to try to solve problems as they were occurring. So the businesses were having problems. We were in a remote environment. We were trying to establish IT and technical systems so that people could do all of this from their homes. The businesses were at home now because in a lot of cases their businesses were closed during this period. So there were a lot of moving parts, and try to do all of this with a sensitivity to the compliance. And so things were changing. And so we appreciate what advice Deloitte was providing us and our other compliance services. But this gives a feel for all of the districts that we have and where the monies went out of that 19 million. And so our objective was we very much engaged the county council folks in addition to providing information in general. There were phone calls to the county council members. We also worked with organizations within their districts that they felt were important organizations to work with. We contacted a number of chambers and other organizations to really be able to encourage the people to apply for this relief. In addition to the Small Business Relief Program, we also started the Small Business Rapid Deployment Fund. And this was one of the suggestions out of the Economic Rescue Team that we have a small business rapid deployment fund to quickly get dollars out to businesses that had specific needs. And so our organization, the partnership, helped with all of this. So we're kind of a natural organization to help with businesses. And so by creating this small business rapid deployment fund, we were able to help about 850 businesses applied. We end up helping about 660 of those with $5,000 grants, and then adding another 2,500 for restaurants that needed assistance. And this was in addition to another program that we had. All of them started with small business. So small business relief, small business rapid deployment, the small business resource program to really help businesses. And we help business initially with loans, and we're able to convert those loans into grants through the CARES process, which was really critical to the businesses because grants are much more appreciated and can help a business sustain its activity longer than loans. And so that just gives you a kind of a summary. But again, these problems haven't gone away. And so we need to continue to help small businesses. We need to continue to help workforce, our community development, as well as our education processes. We're fortunate that we have St. Louis Community College here and UMSL here. And so they've come up with some creative programs that we would, again, like to, that came out of the Economic Rescue Team process, two of the 19 suggestions, that we want to be able to continue the small business and the sustainable education programs. All right, so with that, I'm going to turn it over to our next person.
Thank you so much, Rodney, and really want to say thank you to the St. Louis Economic Development Partnership for the collaboration and help with the Small Business Relief Program, the Rapid Deployment Fund, and just overall support of small businesses in St. Louis County. I'm going to take a brief moment to speak about the Municipal Relief Program, which was part of St. Louis County CARES response that was aimed at supporting local governments and municipalities that are located in St. Louis County proper. So just as a reminder, because St. Louis County's population was over 500,000 individuals, St. Louis County was eligible to receive coronavirus relief funds through the CARES Act directly from the federal government. Local municipalities or small jurisdictions that were located within these jurisdictions that didn't meet these population requirements were left out. And so the 88 municipalities that are located within St. Louis County were not eligible or really contemplated in the CARES Act when it comes to funding and support for local governments. And so through collaboration and communication with the St. Louis Municipal League and 24-1 and other municipal groups located throughout St. Louis County. St. Louis County CARES through Dr. Page directed $47 million to the Municipal Relief Program to support the local municipalities in St. Louis County. One of the big things that was important about this program was to give support to these jurisdictions for expenses that they couldn't get support from other sources such as FEMA, and to provide immediate support for these sorts of COVID related expenses that were not foreseen. again, thanks to the support and the professional services that we were able to receive from Deloitte, we were able to work very closely with all of the municipalities to make sure that they were able to optimize federal resources and reimbursement, and also made sure to manage any sort of compliance-related risks that might be presented by for the municipalities. And one of the great things about this municipal relief program, in which 86 of the 88 municipalities participated, is that many of them were able to complete the documentation, the registration with sam.gov, which is the federal government website that is necessary for them to be in receipt of the funds that are available through ARPA that will come through the state and not through the county. But because of this existing relationship that we've got with the munis through the municipal relief program, as well as what the sorts of requirements that were established by the federal government for us to be able to provide these resources to our local municipal partners, we really feel that we have been able to move them closer to when they are going to be receiving the support, receiving ARPA funds. And so just yesterday, we were able to host many of them for an ARPA 101 sort of basic overview of some considerations that they're going to have to take into account moving forward with ARPA funding. And we are very excited about continuing partnering with the municipalities and trying to leverage the federal, state, and the local dollars that are available through ARPA. I do want to just also mention that this was also, in addition to the Small Business Relief Program, a brand new program that was developed and implemented in St. Louis County CARES. And so again, we had some really wonderful dedicated workers, Kathy Raymer, Joan Kelly Horn, and Ethel Bynum, who have really gone above and beyond to make sure that the local municipalities in St. Louis County were able to receive over $46 million, which comprises a significant portion of the St. Louis County CARES response. One thing that this program also helped us to see and determine was the sorts of categories of expenses that were reimbursed through the municipal relief program. Because St. Louis County provides public health services for all of St. Louis County, and none of the individual municipalities provide services, what we ended up, public health services rather, what we ended up seeing was that a vast majority of the expenditures through the municipal relief program went to reimbursement for employee payroll and benefits costs. That was a very significant development that happened in terms of the regulatory environment later on in the year. I think it was September when that was finally clarified by the Treasury that what sort of payroll expenses and benefit costs could be reimbursed through the CRF. And so what we saw was that a lot of this funding, which is pretty consistent with kind of support and federal funding that we've seen in a lot of different areas, but a lot of that went to payroll and benefit costs. So with that, and using that, just kind of using and learning from the municipal relief program, I'm going to turn it over to Paul Kreitler again to talk specifically about St. Louis County government and the ways in which we use the CRF funds to improve St. Louis County government functions.
Thanks again, Cora. So I'm going to talk about the county, what we call the core bucket, or the county response allocation of the Coronavirus Relief Fund, which is currently at $20.5 million. This source of funding was used to support costs necessary in the operation of county government during the COVID-19 pandemic. So it covers spending from 16 different departments and offices. So very much a catch-all, but again, it's things used inside county government. Save everyone from Chuck. Oh. So for spending to date, we have $18.3 million recorded, and I've broken them down here by functional areas. The largest area being compliance and consulting at $9 million. The largest activity there is with our compliance consulting with Deloitte, consulting from the Boston Consulting Group, and legal services from Lewis Rice. And kind of moving counterclockwise from the bottom, we have software and equipment that was needed to enable remote work, as we all left our various offices and continue providing services remotely, wherever that may have been. We had 1.5 million dedicated and recorded for police dedicated payroll, 1.2 million thus far for workers' compensation costs for employees who were infected with COVID-19 on the job. 1 million for system modifications to one of our large IT systems, almost $1 million for PPE and cleaning supplies to allow people to safely work within our facilities. And then all other costs added together, another 1.7 million. That's everything from overtime to postage to telephone charges. One other way to look at this, I think I'm stuck here, Cora. I'm stuck on Chuck. Now I've done it. No, now I don't know what I've done, Chuck. Hold on. Here we go. Got it? So I mentioned there are 16 departments and offices in our work comp program where the funds were spent. And so this chart details those both spending that's occurred and money that's encumbered. And the 5 largest are right there in the middle. The county executive's office is where we had recorded our Boston Consulting Group activity. The county counselor has our Lewis Rice legal services contract. Information technologies, where we're buying all of our equipment and software, regardless of what department ends up using it. We purchased it all through our IT department. Administration supports our contract with Deloitte. And then police, the biggest piece there is dedicated payroll cost. And finally, I'll give you the top 15 vendors in this core activity. And so these vendors account for 13.4 million of our total spending to date. So that's 75% roughly. And they're all detailed here, which you can review at your leisure. And Cora, I think you're up.
All right, thank you so much, Paul, and really thank you everyone for walking us through the St. Louis County CARES programs and services and our approach to the COVID response in the past year. We're going to take a little bit of time as we prepare to close to talk about some of the lessons learned in each of these different areas. I do want to remind folks that are here in attendance, if you do have questions, to just flag someone and we will bring you a postcard so that you can get your question logged and we'll hopefully be able to answer it. Or if not, get back to you. But I'm going to go ahead now and talk about some of these lessons that were learned throughout the past year. And so what we really saw is, again, this is an unprecedented crisis, and there were a lot of gaps in the laws, infrastructure, rules, regulations that just existed overall that made it difficult to be able to be adaptive to this rapidly changing environment. And so in addition to just a lot of the confusion and misinformation that existed generally about the pandemic and about what was going on. Departments and employees within St. Louis County also really needed more tools to be able to provide residents with services digitally and online. Another key lesson learned and challenge that was faced was around staffing. You know, we were incredibly fortunate in St. Louis County to have such dedicated employees and folks that really, again, went above and beyond to meet the moment of the emergency that was ahead of us. That said, we had folks doing their regular county jobs in addition to the emergency response as well. And so these sorts of challenges that meant that folks were doing multiple jobs and really were overworked was something that we experienced internally in St. Louis County, but we also heard from many of our partners and agencies, nonprofits in the community that we worked with as well, that they too were having to deal with both just doing their regular jobs and responding to the public health emergency. And then speed was something that was challenging. We are still obviously getting closing that learning curve, if you will, for the sort of technology and equipment that is required to be able to provide seamless sorts of digital presentations. So we clearly were not able to get the videos to work today, but you know, that's something that IT has been very keen on investing in, making sure that we are our technology is improved and updated so that we can be more responsive to the new environment that is digital. And so what I'm going to do now is invite everyone back up in each of the different areas, the health, humanitarian, economic recovery, municipal relief program, and then county core, to share some specific examples of lessons that they learned in each of these different areas. Dr. Khan?
Thank you, Cora. It's a long list of lessons that we are still learning, obviously. Some key ones. Just because we put money out there doesn't mean partner agencies are able to receive that money and implement programs the very next day. The fact is that the not-for-profit sector, community-based organizations, and smaller agencies out there do not necessarily have the bench strength or the wherewithal to immediately receive money, be accountable, transparent, and provide services with the speed and efficiency that was the need of the hour. And a lot of agencies struggled. We had to invest a significant amount of our time and effort in building up their capacity and providing support for them to do so. Testing was a major challenge. The capacity of the United States at the federal, state, and local level to provide supplies out of the so-called strategic national stockpile was a major challenge. In the weeks and months ahead, hopefully post-pandemic, when we get towards doing a thorough review of what could have worked, one of the things that will come to light is that this so-called strategic national stockpile is something that exists only in words, only on paper. It is empty. The federal government was unable to provide a single mask or testing supplies. That was a colossal failure of public health at the national level, and it is shameful for the United States. The fact is that producing prevention materials in the absence of therapeutics or a vaccine, which wasn't available for most of 2020, remember, the only tool in our armory was prevention. Well, what sort of messaging did we put out? In how many languages? At what reading level or literacy level? In what cultural context? In what venues? What is the net effect? How do we measure it? How do we find out what's working and what's not? while we're in the middle of mass panic, and as Rodney pointed out, our economy at risk of folding and people's livelihoods suffering every single day. That was a massive challenge, not just for public health, because we were in the eye of the storm, but for all our partner agencies that you've heard from today. I don't have a clear answer on that. I think in the months and years ahead, as we take a look back at what we could have done differently or better, that may or may not become clearer. Lastly, personnel. The unique skill set and experience required to prepare for emergencies was missing. And that is a result of slow attrition over time. It takes decades, if not years, to train someone to do a job well. It takes one day for them to leave for a better job elsewhere in the private sector. The fact is that the public sector has not caught up in terms of retaining talent competitively. And that is to our great detriment at all levels, federal, state, and national. And did we pay a price? Oh, yes. So when we talk about heavy reliability on consultants to shore up our workforce and provide us with workforce multiplying options and bench strength, it is only as a crutch because we are missing that bench strength fully as a result of chronic underfunding of systems across the board. Those are just some of the lessons we've learned so far. I'm sure that list will grow. Thank you, Cora.
Like Dr. Khan, our key takeaway was the capacity of the organizations. We were trying to quickly deploy resources and comply with ever-changing rules and guidance. And it was very cumbersome collecting the required documentation to deploy those resources. And again, to what Dr. Khan spoke to, about quickly getting those resources out, the organizations being in a place to deploy those and having the capacity and the staff to comply with all of the substantiation and the documentation required. I think that was really evident in the Child Care Relief Program. Small community-based organizations who may not be as familiar with federal and state guidelines, and certainly the county guidelines and the documentation required to be eligible for those programs. And they also lacked the access to technology. We had online application systems and struggled with technical difficulties and being able to receive those applications. I think, one of the key points that we spoke, what Christina spoke about was clearly defining your RFP. What does eligibility look like? What's the required documentation? And what does compliance look like? So those are a few key takeaways from our Child Care Relief Program. I think too, in the staffing, just being able in the county to deploy these resources. St. Louis County Children's Service Fund, our main function is allocating $42 million a year in mental health services. And so we took on another, in collaboration with the Department of Human Services, another $30 million, and we're releasing RFPs every month through the summer and developing new programs. So having the staff and the capacity to do that work. And I just reflecting on this presentation today, all that we accomplished, and it's everyone in this room too, working collaboratively that we were able to accomplish it. And I want to thank my team at CSF and Human Services for stepping up to the challenge. And so those are just a few key takeaways. Thank you.
You know, they say teamwork makes the dream work, and that was critical. I think we all had to become great partners, and we did. I mean, because there was a crisis, and we needed to get the resources out. And I definitely want to thank our team, the St. Louis Economic Development Partnership team. We have Netta Kowalski here, who's our CFO, who also loves being an IT person. And so she came up with all these wonderful solutions. At that time, Erica Henderson was also really tied to the community, has always been very tied to the community, and did a great job connecting us with other resources in the community. And then our whole organization kind of transformed from doing their day job to becoming business navigators. And that was just critical. And as we talk about going forward, having that business navigation kind of capability just built in is critical to help these businesses grow and continue to be sustainable. Jansen Thomas really helped the economic rescue team just continue to move forward. And we had other support with Tracy May and others to kind of help that keep going. But the technology, we were all learning technology at the same time. We were learning how to DocuSign and do all of these things electronically. How do you do ACHs and not do a physical check? And sometimes that energy level would say, can't we just get them the money, get them the money. And we said, we got to make sure we follow all these rules. And so again, the compliance piece was very helpful. But so we were helping people learn technology and follow the rules as we were learning all together. And again, trying to work effectively as a team. And partnerships do matter. And so we became much closer to all of our county departments and colleagues through this. So, when you have a crisis, people do kind of bind together. And so, that was critical. So these type of things, if we can establish these on an ongoing basis, then we could be ready for any crisis.
From the county response viewpoint, I think it's really pretty well summarized here on the graphic on the screen. But I think as I reflect just from my experience as a division manager within the county and from what I've seen across the other departments is that we found ourselves behind. We really had systems and technology that was maybe a decade behind where we should be in terms of providing services to the community. So I think one of the big lessons that we need to take from this is, keep building on the progress we're making in terms of modernizing our website, the ability for our citizens to interact with us digitally, the ability for us to quickly pick up our equipment and go work in another location. I'm sure every department or division manager would have a laundry list. Our IT department, I'm sure, would have a list, our procurement division. So we're all going to be reflecting on this experience and determining how we can best move forward and position ourselves for the next emergency, whatever that may be. Cora?
Thank you, Paul, and everyone for sharing some of those reflections. I think it is safe to say that despite the fact that this is something that no one could have foreseen or could have expected, that folks really did go above and beyond in response. And so I just want to, again, take a moment to acknowledge all of the hard work and dedication of our county departments and workforce and team, just the exceptional public service that they have been able to provide over the past year in this COVID response. And we are hopeful that this information that was provided in this report this evening can give a little bit more insight into really the teamwork that took place in order to get these resources out into the community and the continued collaboration that is going to occur as we're moving forward into the recovery phase. So I'm going to leave our contact information up here for folks, and then I think Chuck is going to hopefully show some of this IT. That is correct, Chuck. Thank you.
Is that not coming up? No. Well, I got the playlist, but not the individual videos. Comes up. I can't make the box to go away to get to the audio. My mouse won't work over there. So, sorry.
Make sure to make these available online. So with that, I am going to go ahead and adjourn. And want to thank everyone for joining us again this evening, and have a good evening. Thank you.